I want them to know that there's someone out there that will sit down and listen to them.
I want them to know that we are here to help.
There's a safe place that they can go, and we can just sit down and talk.
You get to call the shots here, and you get to determine what is best for you in the situation that you're faced with. When you come to the Sexual Assault Treatment Center here, you'll be greeted by a sexual assault nurse examiner, and they are specially trained, registered nurses to serve your needs to the very best of our abilities. When they walk through the door, they're uncertain about what's going to happen to them, and when they leave, I want them to feel like their anxiety is less, that they're empowered, that they've done the right thing, that they have, that they can feel like they're on the road to recovery. The Community Hospital Sexual Assault Treatment Center serves a variety of patients: children, teenagers, adults, both male and female. You will be escorted to a conference room where we sit and talk and kind of find out what's going on. The nurse can then determine what your needs, your specific needs are, and then we'll do an examination, which includes evidence collection. We also provide emergency contraception if you need it. We also provide antibiotics that will guard against a sexually transmitted infection from developing.
We want you to come in a timely manner, if possible, to not change their clothing, to not shower, not eat or drink anything, smoke a cigarette, and if at all possible, to try and not go to the bathroom, just so we can preserve that evidence. Even though our forensic evidence may be limited, seeing them on that 4th or 5th day, even after they've showered, it's still important that we evaluate those patients. So we always encourage patients to be evaluated, and we'll discuss the options despite what the time frame is.
The emotional toll that a sexual assault takes, they need someone to talk to. And so we can make those arrangements for them also.
If someone's watching and they're on the fence about being evaluated for sexual assault or abuse, I want them to know that there's resources out there available for them. I want them to know that there's a safe place that they can go. We are focused on the patient, we're victim-centered, we're trauma-informed. We want to meet all their needs, but I want them to know that there's someone out there that will sit down and listen to them.
I tell them I'm not the police. I am just here to take care of you medically, make sure there's no injuries, and if there are, we're treating them, and there's no judging here. And it's not your fault. I tell them many times it's not their fault.
Trying to handle this at home, we have seen, through several patients that we've cared for, it just doesn't work. And it helps to have that advocate there, that nurse. The services that we provide will help them move forward so they can begin to heal from this horrible event that has happened to them.